Good morning and happy Friday. It's day 2 of module 157 in our SIM charting. And today we're going to talk about telephone techniques. You had me from hello. So we've spoken in class a little bit about how important it is to give good customer service. No, we don't work at Walmart or Super One or go down the road where we have to talk to customers in that capacity. But remember, the patient is your customer. They are the reason you get paid. So, okay. Uh-oh, guys, give me just a second. There we go. I need to move my little doohickey down so I can see. The telephone is one of the most important pieces of communication equipment and is often the first interaction a patient will have with a physician's office. When patients call the physician, they expect a certain etiquette for the medical office administrative assistant's undivided attention. Since the medical office administrative assistant doesn't know who's on the other end of the call, he or she must keep an appropriate telephone voice using proper etiquette techniques, including diction, pitch, tone, enunciation, volume, speed, and pronunciation. The administrative assistant must also be a good listener and answer the phone in a professional manner using best practices. Now that sounds like a mouthful, right? But most of us know about customer service. Most of us know about politeness and etiquette. So when you're talking about this group of, dictation, pitch, tone, you're already practicing that in everyday communication. But let's just take a moment and break that down. So if someone calls, ring, ring, hello, this is Marcia from whatever clinic. How can I help you today? That is very easy, right? That's a customer service voice. That is not, hi, no, they don't want to hear that, or they don't want to say, yo, this is the medical office. Yes, that is a little dramatic, and no, you wouldn't do that. But you also don't want to answer the phone. Thank you for calling medical office. This is Miss Marcia Gallagher. How can I help you? That is not what a patient wants to hear over the phone. So I have always taught one simple rule. If you have a smile on when you talk, that's how you sound. Hello, this is Marcia from whatever medical clinic. How can I help you today? See, it's easy to do that if you just imagine that you have a smile. Proper telephone etiquette is about making a good impression when speaking on the phone. Medical office and administrative assistants will want to be courteous and helpful. They should give the caller their undivided attention and never try to do another task at the same time as talking on the phone. As a front office receptionist of a physician's office, that is hard, but you will learn to navigate that. Some patients will not want to remain on hold, so proper etiquette dictates that the medical administrative assistant should ask if they want to receive a call back. This return call should be placed in a reasonable amount of time. Proper telephone etiquette recommends that the medical office administrative assistant should use the patient's name, which will give the patient a positive feeling about the physician's office. Hello, this is Marcia Gallagher at Medical Clinic. How can I help you today? Okay, may I have your name? Hi, Mrs. Jones. Yes, absolutely, we can help you with that today. See, when they tell you their name, you just give it back to them. Effective listening etiquette techniques and best practices. Effective listening etiquette techniques by medical office administrative assistants will allow them to understand whether a call is an emergency. They should permit patients or physicians to complete their thoughts rather than anticipating what they are going to say. They should also repeat back the caller's request or thought so that the caller knows that the medical office administrative assistant is listening. We just talked about that with the name. That's active listening. Give the patient their name back. Oh, yes, Mrs. Jones, you need to make an appointment for next week. Okay, just one moment. Let's see what we have available. You're just repeating that back again. Answering the telephone professionally. Answering the telephone with a professional manner involves answering within 2 or 3 rings. May not think that that's important, but please remember that. You need to answer within 2 or 3 rings, so the caller is not left waiting. If taking multiple calls, proper etiquette suggests that you give the first caller priority unless the second caller has an emergency. Always ask the permission from the caller to be placed on hold before you do so. Yes, Miss Jones, can I get you to go on a brief hold for me? I'll be right back with you, and place them on hold and answer the next call. Proper etiquette suggests that the medical office administrative assistants should identify the facility in their own name when answering a call. And I've just demonstrated that to you with our little scenarios we're talking about. Next, the medical office administrative assistant should identify the caller's name in order to refer back if needed. We just talked about that. And we talked about putting the patient on a brief hold, ask their permission, and then if they need to be transferred. Yes, Mrs. Jones. Okay, right away. I'll get you over to our billing department. Please hang on while I transfer you. Get her to the department she needs, but you're telling her you're transferring her. If taking a message, it should include the name of the caller, who the message is for, the telephone number of the caller, the time and the date of the call, and any message that needs to be conveyed. Once the call has ended, the medical office administrative assistant should thank the caller and close the conversation. The phone line should be left clear for other calls or emergencies that arise. Yes, Mrs. Jones. Okay, let me take that message for Nurse Betty. You need a refill on your levothyroxine and your Zoloft. Okay, yes, ma'am. All right, I will take care of that. I will send a detailed message to Nurse Betty, and she will be getting back with you. Have a great day. Thank you so much. Bye-bye. Very easy, right? I'm good at telephone etiquette. I like to answer the phone. Now we're just going to talk briefly about types of incoming calls. Most incoming calls are from patients, but the physician's office will also get calls from other physicians, insurance claims agents, medical sales representatives, laboratory personnel. You need to always use proper phone etiquette with whomever you're talking to on the phone. Telephone calls from patients may have to do with appointments, scheduling, billing, inquiries, requests for medical lab results, questions about medications, prescription renewals, progress reports on treatment success, requests for advice or complaints. The medical office administrative assistants will encounter a wide variety of questions and requests when you're answering the phone. Most incoming calls from patients, but the physician's office will also get calls from other physicians. And this is just, again, I don't know why that slide isn't here twice. So let's talk about HIPAA. This is very, very, very important. According to the Health Information Portability and Accountability Act, that's what HIPAA stands for, of 1996, a medical office administrative assistant is not to discuss a patient's personal health information with anyone other than the patient. HIPAA requires appropriate safeguards to protect the privacy of the PHI, protected health information. The medical office administrative assistant should comply with the patient's request for their own information. Proper phone etiquette discourages putting patients and medical professionals on speakerphone. If the medical office administrative assistant is going to talk with the patient or authorized provider, all information should be kept confidential. So you guys, listen, I'm a speakerphone kind of girl. 9 times out of 10, if you're talking to me, you're on a speakerphone. But in order to be compliant with HIPAA in your medical office, you cannot do that. Occasionally, a patient's family member or a friend will call. The medical office administrative assistant should keep the patient's information confidential and obtain authorization from the patient before disclosing any information. Want to learn more about telephone etiquette best practices of the medical office administrative assistant? Ready for an exciting new career in the health field? And this is just part of the article where I got this. So that's a lot of information, right? But it's all good information, and it's easy information, and it's easy information to implement. So we're going to be talking a lot about etiquette and how to answer the phone and how to interact with patients in this module. So this is your bell ringer. This is your question of the day. Why is it important to make a great first impression, whether it be on the phone or in person? Submit that answer to me, please. Have a great day, and I'll talk to you soon. Bye-bye.